So we're going to attempt to show a very non-specific method that Dr. Still describes. One of the problems with a lot of Dr. Still's writings is that there are a lot of details that aren't there. It's essentially looking at setting a shoulder. So he talks about setting the hip, and you can see some of those methods that we've already displayed. But setting the shoulder, it says, in setting a shoulder after a thorough loosening at the articulation, use but little force and push the elbow towards the contracted muscles at the shoulder, then rotate the humerus into its socket. Okay, so the thing that you can try to figure out with respect to loosening the muscles is you assess the soft tissues around, figure out which muscles you need to loosen, and then using the elbow to push towards. It's not specific. One of the reasons it's not specific is because there may be different angles. So depending on the muscles, so all it would be is I would have, now if I do this, sorry, let's be clear. If I do this, it won't work, right? So this is going to move the whole scapula, the SC joint's moving. This won't work. When he says this, what you're going to have to do is fix the scapula and clavicle. So all you have to do is put a hand on top, and then you would do this, right? Is what he's talking about, and then create rotation. So depending on where the shoulder had a problem, right, we examine, maybe this feels a little funny, this position doesn't feel like much would happen, right? So we kind of find a position. I'm going to have to stabilize the top of the shoulder, so I have to stop the clavicle and the scapula from moving, and then do this and create kind of rotation, right? This is what he's talking about. So you need a still scapula and clavicle, moving humerus, and it's a compression. But it is a relatively non-specific description of it, so it's harder to figure out what he meant. Maybe that leaves you more room for interpretation.